So hello everyone. So this session we are going to deal with rodent behavioral models and setups. We have gone through all the neurosurgical procedure, neuroanesthesia procedures. So the implantation is already done. Now there is a need that all of you should have some idea as to how you're going to set up the experiments and how are you going to replicate the behavioral model which will sort of mimic the actual disease process in humans. That's the whole idea. So it's very important. Not only you need to have a right setup, you need to understand the disease process very well so that you can replicate that in the animal model. And most of the diseases are not the ones which would occur naturally in animal models. So you need to sort of create the animal model from scratch. You need to inject some agents, and reproduce the manifestation which will mimic very closely the disease process. So it's very important not only with respect to the animal but also to have a right experimental setup which will bring out the symptoms or the manifestation in the animal, and you can analyze it and correlate with your research question. So in that regard it's pretty important to understand the whole setup, and that's the whole idea. And so let's look at two important models. So today we are going to deal with a stroke, and maybe in the next session we will deal with the Parkinsonism. I've chosen these models mainly because one is that it's pretty common and most commonly used neural model, and the other model that we are not discussing is epilepsy, which is also a good model to look at and pretty commonly used models. I've chosen these two because the motor manifestation is easier to bring it out, and it does require some sort of a good setup to do the experiments, analyze the movements of the animal, and there are various apparatus that needs to be set up to study and achieve the objectives of your particular project. So these are kind of models which are like a good prototype of any neural engineering projects, be it you are trying to look at the electrode implantation, or you're trying to look at the functional aspect of the area that you're studying. So various such applications are possible, and they are also very interesting. So I've divided the models into sections wherein you need to understand what it means, what exactly the stroke model means, and what are the clinical features, and how are you going to set up the test apparatus, and what sort of behavior are you going to really look at, and how do you analyze it. So we'll go through each of these sections, and we'll focus only on the stroke model for today's session. All right. So first and foremost, as I said, you really need to understand what this disease process is and what needs to be done. So stroke is basically the result of ischemia. So it's also called brain attack, and I'm pretty sure all of you are aware that cardiac arrest or heart attack is a pretty well known phenomenon, and I guess even stroke most of you must have heard, and that how it manifests. But what brings out this stroke as clinical entity is the block in the blood vessel or rupture of blood vessel. Both lead to loss of function in that particular area. All right. So that is very important to understand. All right. So there are two types of stroke, as I said, that is the ischemic stroke and hemorrhagic stroke. All right. So ischemic stroke is by the block in the blood vessel. So how is this block? How does this block happens? So commonly it could be This is the normal carotid artery and this is the diseased carotid artery. You can see there is a fibrofatty plaque. Alright. So this is the similar process that happens in the myocardial infarction or the heart attack or cardiac ischemia. Similar to that, the blood vessel get clogged with these fibrofatty plaque along its wall and it ruptures and forms a thrombus. So it can completely block the blood vessel and then the oxygen and nutrient supply to that part of the brain is lost. So it will undergo cell death. Alright, so that is the basis. Due to the absence of oxygen and glucose, there occurs cell death. So to what extent this occurs depends on the segment of the vessel that is affected. For example, if it's very terminal end of the arterial supply, then a small area is affected. Whereas if there is a block here, then the entire hemisphere can get affected. So it will vary depending on to what extent the where exactly the ischemia is occurring, where exactly the block is occurring. Alright, or sometimes what can happen is from the heart there are these clot formation because of the valvular heart disease or various other reasons. There may be clot which gets dislodged from here and then go and blocks the terminal vessels. That is called embolic stroke. Alright, there are too many terminologies. You just need to have a rough idea as to what these terminologies means, because you are going to create various models and we are going to look at some particular model that we are going to discuss, and so it is good to have an idea as to what is the pathophysiology behind it and how the clinical manifestations are going to happen, so that you can recreate that in the animal model. So embolism is a term where the clot comes from the distant source, whereas the ischemic stroke or the thrombotic stroke where the thrombus forms within the vessel and that leads to ischemic infarct. Alright, that is the ischemic stroke. It can be due to thrombus at the site or embolism from distant site. Alright. So now then you have hemorrhagic stroke where the blood vessel ruptures. The most common cause is hypertension. Alright. So when it ruptures, the damage is catastrophic. Alright. So where you can see here it is ischemia. If it's the hemorrhagic stroke, you are going to have a big clot here. The blood leaks into the brain substance and it damages the places wherever it has seeped. And then there is some toxic metabolites which will come out of this clot and then acts on the brain parenchyma and the damage continues. So that is another form of stroke which is called hemorrhagic stroke. So that is the stroke pathophysiology in a nutshell. There are a lot of things that need to look into, but then just to understand briefly what the stroke means, and this is what it is about ischemic and hemorrhagic stroke. So what sort of manifestation are seen in the patients who are suffering from stroke is, then plus this is an emergency. Okay, usually it comes in a very a short time. The presentation time is pretty short. That is, if the stroke is in the morning, usually the patient ends up in hospital within an hour or 2 hours, and that window is also very important as to when they see the clinician, so that the clinical intervention can happen as fast as possible. And that is why they have come up with a beautiful mnemonic of B fast. The B stands for loss of balance, headache or dizziness, blurred vision, one side of the face starts drooping, arm or leg weakness, speech difficulty, and then of course you need to call the ambulance immediately. So this is sort of an awareness as well as to how emergency the stroke manifestations are and the stroke symptoms are. Unless you recognize these symptoms as a stop sign to whatever the patient is doing at that particular time, and then shift the patient quickly to the clinical facility. So these are the warning signs. And why does this happen? As I said, I can go back to the previous slide. This is the, if you remember the neurophysiological discussion that we had, there are these motor area, speech areas, visual areas. So depending on the part of the brain that is blocking, part of the vessel that is blocked, it leads to various manifestation. If it is the middle cerebral artery, it generally leads to the speech difficulty and motor difficulties. If it is the posterior cerebral artery, predominantly leads to visual loss. If it is the ACA, anterior cerebral artery, it leads to predominantly the lower limb weakness. So depending on the vascular distribution of the arterial tree, the manifestation is going to be different. But by and large, the predominant symptom will be weakness, alright. And in humans it can be speech difficulty, and this weakness can be in face or in limb. Not only that, they can also have decreased sensation in the limbs, alright. So these are the cardinal manifestations with which these stroke can be picked up. More importantly, these are the manifestation that needs to be reproduced in your animal model as well. So your stroke model that you are going to choose, there are n number of stroke models that are available in the literature. So I would suggest you choose a model which would give a good infarct in the brain and produces these symptoms. That is very important to design your stroke model and to execute the experiment, alright. So that is the whole idea of discussing these symptoms, so that you will sort of replicate it. So this is the pictorial representation of that manifestation which I said. Hemiplegia is the very important manifestation of the stroke. So the blood supply or to this particular sensory motor area suffers, and that leads to the facial drooping and limb weakness. Patient will be unable to move the upper limb and the lower limb. So that is how we diagnose that the patient is is having stroke, and we need to intervene as early as possible, alright. So how do we replicate those symptoms which I just mentioned in the rat model or the mice model? First and foremost, it depends on your research question. What are you trying to really look at? Are you trying to look at the motor system per se? In the sense, are you trying to look at the physiological aspect of the motor network? You want to study how the premotor area works, how the supplementary motor area works, how the primary motor area works. So these are the physiological consideration. Or you are trying to look at just the purely an anatomical basis for stroke recovery or stroke manifestations. You are trying to look at the disease per se, or you are trying to look at the rehabilitative aspects wherein you want to study how the motor recovery really happens. So that sort of objectives are very important to design your experimental subjects or design your experimental setup, alright. So one example is that if your study involves lot of motor movements to be looked at, then it is very important to look at what sort of species are you trying to look at. Is it long Evans rat, Sprague-Dawley rats, or Vista rats? So you have many such species. So which species do you really select for your study? That is also equally important, you understood. So by and large, it is considered that for a cognitive study and a study which involves lot of motor movements, long Evans rats are preferred, alright. So I will come to that comparison in a while. So choosing the right species is of paramount importance before you even design your study. So, go through the literature and understand your objectives, list out your objectives, then look at how do we select a particular species which would give us a good performance in terms of behavior. In the end of your experiment, you are trying to analyze certain behavior. So, the animal model that you are going to choose should bring out those clinical manifestations, should bring out those behavioral targets to analyze it better. So, that is very, very important. And the other parameters of course are age, gender and body weight. If you are trying to look at a certain specific parameter, you need to make sure these are homogeneous, so that it does not become a confounding factor in your study. I mean, that is obvious. Any study that you would try to look at, and you need to list out the variables for your study and make the group homogeneous. So, that homogeneity is of very vital importance even in this particular animal models, alright. That is one thing that you need to consider. And then you need to see whether your behavioral test apparatus that you are going to use is going to address the objectives in terms of the muscle group that you are going to look at, or the nervous tissue that you are trying to study, or the level of nervous system that you are trying to study. Are you trying to look at central nervous system? Are you trying to look at only peripheral nervous system? Are you trying to study only the muscle movement? What are you really trying to look at? So, that decides your test apparatus. Okay. That is the key word. The test apparatus that you are going to use should be appropriate with your objectives. So, choosing a right apparatus, right species and looking at the right age, gender or body weight, all these are the parameters that you need to consider before finalizing your study design or the experimental design. So, I have taken an example of lever press apparatus versus Visha test. And how do you really select it? The only way is to look at all the literature that is possible. So, this is just to sort of prime you to the possibility that if you choose the wrong apparatus, you are not going to bring out that particular behavioral manifestation, alright. So, this is sort of a vague example. I am not saying this is that is very specific that the lever press will only give proximal. Yes, there are distal fine movements occurring even in the lever press, but I would bet more on the V-shot test, wherein the rat is going to grab the pellet. It is a pellet reaching task, but there are some pros and cons for V-shot test as well, whereas where the rat end up in chewing, and if you are going to implant some electrode and want to acquire neural signals, this chewing is going to give a lot of noise. So, that is exactly what I am trying to highlight here. You need to sort of consider every single objective, look at the advantages and disadvantages of each test that you are going to consider and choose the best possible test apparatus which is going to give you the best possible going to help you with the best possible objectives, alright. So, lever press, the shoulder and elbow movements are more than the digit movements, alright. So, this is considered as proximal. So, that is why I am saying if you want to look at the proximal muscles or what is known as rostral forelimb area, then the lever press is fine. If you are trying to study bit more distal, you need little bit of finer movement that is going to come in, then I would strongly recommend Visha test. So, that is an example that I can come up with for the appropriate test apparatus. So, similarly, such test apparatus is present in Parkinsonism as well. What are you really trying to look at? Are you trying to look at the gait of the animal? Are you trying to look at the limb movements of the animal? Based on that, the test apparatus should change or vary, which is appropriate to your study objectives. So, as I said, there are various methods of inducing the stroke. Okay. So, and this is the normal anatomy showing the middle cerebral artery territory. So, this is commonly chosen because it does lead to significant amount of forelimb weakness, alright, and it causes the classical hemiparesis which we just discussed because of the supply to the big bundle of motor fibers which descends from the cortex. So this classically leads to hemiparesis, and if you are trying to look at the stroke manifestation, you need to attempt and coagulate this particular middle cerebral artery. But then how you do it, again there are a lot of ways to block the middle cerebral artery and cause MCA territory infarct. Infarct only means death of that particular area in the brain due to ischemia. Ischemia is reduced blood supply. Ischemia leads to infarct. So these are two terminologies that you should be familiar with if you are dealing with stroke models. So how are we going to do that? So there are methodologies where you do intraluminal microinjection of thrombin, wherein you are trying to induce thrombosis. Thrombosis in a plain English is clot formation. So you are going to induce thrombosis in this vessel by intraluminal microinjection of the thrombin itself. Alright, that's the coagulant catalyst. Alright, so are you going to use that, or are you going to induce endothelin endothelin 1 microinjection, which is a strong vasoconstrictor and a platelet, it induces platelet aggregation. Alright, so these are the indirect method. Or are you going to use intraluminal filament and cause an embolic stroke? If you are trying to simulate, or if you are going to replicate embolic stroke, then you need to introduce. So these are angio intervention, where you are going to pass the catheter from the distal vessel, then proximal vessel, and then move distally, and then you leave the embolic material there, so that will mimic the embolic stroke. The preferred method or the commonly used technique is electrocoagulation. Alright, so this is the technique which I would prefer, because it's little bit of, it's straightforward, and then it does mimic the actual stroke that happens in humans. Alright, mainly because you can coagulate the proximal most portion of the middle cerebral artery, whereas intraluminal microinjection you need to have a very good control, otherwise it will damage the vessel and cause bleeding, and plus it is for distal vessel and the area that is covered is smaller. And endothelin 1, it is sort of an indirect method which may or may not work, so you need to sort of supplement it with clip occlusion, whereas if you directly inspect the vessel, identify the middle cerebral artery, and then coagulate using the bipolar cautery. If you all remember, I have covered this particular session in the neurosurgical aspect, where it requires a special craniotomy to expose this vessel and then coagulate. So it is a pretty direct method of inducing the stroke. Alright, so we will look into bit of a detail as to how we cause this particular model, or how we can create this model using the electrocoagulation. So in that particular way of creating the model, stroke model, we need to occlude right middle cerebral artery, then there is common carotid artery occlusion, and the left CCA temporary occlusion. Alright, just to briefly explain to you, there are right and left carotid artery in the neck of the rat. Alright, this is the supine, the rat is lying with belly up position, and to the neck, that is the big vessel there, that will divide into anterior and middle cerebral artery when it goes up to the skull. Alright, so the model of middle cerebral artery occlusion is such that not only it causes the artery occlusion there, it is best to occlude the artery in the neck as well, and then do the temporary occlusion on the opposite side. This is to make sure that there are no collateral circulation. The collateral circulation is a very common reason for failure of your stroke model. So what does this collateral circulation does? Let's say you've done only this, alright. So common carotid artery goes, the blood goes to the antecerebral artery and there are some communication to the middle cerebral artery and it starts supplying the area that you just occluded. Or the opposite vessel can go and then get anastomosed to the middle cerebral artery and then supply. So you need to make sure this collateral supply is taken care of. This collateral supply should not happen for your manifestation of ischemia and infarct. That is the end result. You need to induce ischemia which should cause the death of the region that you are trying to study. Alright, that is the end point. So to prevent the collateral supply, you occlude the opposite common carotid artery and you permanently occlude the ipsilateral, that is the side that you are studying, that artery should be permanently occluded. So that would mimic the right MCA stroke, alright. So this has been proven, so that is the particular reference that I am using. They have even looked at the MRIs, preclinical MRI, and they have proven that the manifestation in the brain is similar to the human model, where it causes selective middle cerebral artery ischemia and infarct. So that is the whole point of using this particular technique to create the stroke model, alright. So this is what even I would prefer. As to how it is done, I have covered it already, where you expose the neck, expose the carotid artery, ligate the carotid artery permanently, just occlude it with a clip the opposite side, turn the rat into lateral position, expose the middle cerebral artery and coagulate it. This has been covered in the neurosurgical sessions that we just covered, alright. So once that is done, then you release the occlusion after 1 hour, alright. So that is the whole procedure to create the stroke model. Now let us look at the species selection which I was talking to you all about. If you are trying to look at the movements and if the cognitive aspect is pretty important in your study, then the preferred species is long Evans rat. Okay, this is proven in the literature as to how long Evans rat fare definitely better than Sprague-Dawley rat or even the Wistar rat, alright. Sprague-Dawley definitely performs well compared to Wistar, but it is proven that the long Evans performance is even better than Sprague-Dawley if you are looking at the motor movements, if you are trying to look at the cognitive performance. One of the reason is that because this has pigmented eyes, as compared to the albino eyes of the albino rats, it's reddish, the pigmentation in the retina is not that great. So that would improve the cognitive perception, that is the rat can definitely see better, the vision is slightly better compared to the other rat. And not only that, even the brain evolutionally, though it is a lab rat, the brain of the long Evans rat performance wise is definitely better than the Sprague-Dawley rats. And how does it make a difference in the performance? If you can see the advanced movement that can happen, you see the raise is pretty much more in the long Evans rat compared to Sprague-Dawley rat, alright. So it is easier, for example, if there will be a video recording and there will be what is known as kinematic analysis, alright. So when you do such analysis, you want the movement to be really good, that is appreciated in all the frames that you are going to catch through your video recording, alright. If the movement is pretty quick with the smaller amplitude, which is what has been shown here, the amplitude of the range of movement should be good enough that which gets captured even by the naked eye or by the video recording. So then obviously you need a rat which performs that way. So that is why long Evans is better in the way that the movements can be captured better if it is the long Evans rat. So one such example is the advanced step of the pellet retrieval. We will go through various steps that needs to be studied or to be looked into before you score your performance of the animal. So one such step is the advance. The next obvious step is the arpeggio movement, where the hand is, it's a prone position of hand in order to grab the pellet. So that sort of movement is pretty exaggerated and the amplitude is pretty good as compared to this spread dolly, which is a very short movement that happens and it retrieves it faster. And if you can see, even the arpeggio movement, when it grasps it, it uses all the fingers, whereas if you see, it will be usually between the index and the middle finger. So that again is sort of pretty crude movement that happens. This is pretty close, alright, and the drop rates will be probably higher in the spread dolly as compared to the grasp that happens with the long Evans rat. So the grasp is definitely better and the spread dolly that the grasp is pretty gross. So because of the finer movement, long Evans rat is definitely better. And not just that, the duration if you see is pretty fast. It's faster performance, the grasp is good and its time taken is definitely lower than the other species. And the grasp lift probability, very high probability that it is going to lift the pellet once it is grasped, whereas it is low in the other species. Then the supination duration again is pretty quick and fast when it is supine and then goes out of that slit. So this you will understand it better when we really start looking at the test apparatus. So similarly there are various other movements that are better with long Evans as compared to the spread dolly rats. Alright, so that is how the species selection comes into picture. So this is what the stroke surgery that I was talking to you about, that you are going to permanently occlude one side and temporarily occlude the opposite side, so that the collateral circulation does not rescue the vessel that you are trying to occlude. That is the whole idea. So identification of middle cerebral artery is very, very important, should not be confused with inferior cerebral vein. This has been dealt with when we went through the session on neurosurgery, and then that is how the craniotomy is done and the vessel is seen, that is middle cerebral artery. Then you coagulate in under direct vision using bipolar cautery. Alright. So you need to coagulate and ensure that middle cerebral artery is occluded, and then you come back and release this temporary occlusion after 1 hour. So that ensures that this particular area suffers complete ischemia, and then it results in the cell death, which is called infarct. Alright, so that is the creation of the stroke model by doing the surgery. So in next session we will deal with study plan. Alright, thank you for your kind attention.